Hello, everybody. Good morning. And depending on where you're joining us from, good afternoon or good evening. Welcome to the 21st Annual IHA Health Literacy Conference. I'm very glad you are able to join us, and I'm very excited about this year's program. Um, we have been doing this conference for 21 years. We've been doing this conference virtually since the pandemic hit in 20. So this is our third remote conference, and we have a really great program coming up for you, and we'll get into that in just a moment. Before we start, though, I did want to just tell you a little bit about us, the sponsors of this conference. My name is Michael Valere. I'm president and CEO of the Institute for Healthcare Advancement. And for this particular conference, I'm a little bit of a numbers nerd, so thank you in advance for indulging me. We're really excited that we were able to provide registration, or we have registration for more than 1,700 people for this conference. The conference is being recorded, so if you do miss any of it sometime next week, you'll be able to go back and take a look at any of those sessions. We have attendees from all 50 states, plus the District of Columbia, and representatives from 36 different countries, which explains my good morning, good afternoon, and good evening greeting for you all. As you know, since the pandemic began, we started doing this conference. We waived, when we started doing the conference virtually, we waived the tuition for you to attend because we knew during the pandemic, a lot of you coming up with tuition, being able to travel, et cetera, to get your continuing education credits was a little bit of a challenge. So we decided to waive tuition. What we did ask was that you make a voluntary donation to one of several charitable organizations that we identified that were sort of aligned with the mission and vision of what that year's conference was. I'm happy to announce we've raised $10,000 that'll be allocated among those different charitable organizations. So thank you for those donations. The window to donate is still open. So if you weren't able to make a donation before, or you wanted to throw a few more bucks in the pot, please feel free to do so. So with that, let's go ahead and get started. As I said, I wanted to just let you know a little bit about us, IHA. We're a nonprofit organization. We've been around since 1993, involved in health literacy since 1999 with a mission initiative to advance health literacy toward health equity. What we really try to do is provide you with the tools and the resources that you need to be able to do your job effectively. Next slide, please. One of those, a couple of the things that we do in order to make a little money for ourselves so we can keep doing what we do. We sell this series of books, the What to Do for Health books. These are self-help health books for individuals that are written at a 3rd to 5th grade reading level. They're available in English and Spanish, and a number of the titles are available in a number of different Asian languages. More than 5.5 million copies of these to date since we started that. Next slide, please. And we also have these other small books called micropubs. These are little 24 to 40 page booklets. Some of these provide people with ways to help them manage their chronic illnesses, chronic diseases. We have a series of these on COVID and dealing with COVID, and then also in keeping with the theme of Mental Health Awareness Month and the theme of this conference, we have some of these micropubs that are on helping people to deal with various mental health issues as well. And these are also written in an easy to read and easy to follow format. And for those of you who would get these to distribute, there are some co-branding opportunities for you. Next slide, please. So now on to our free stuff. So we started publishing this online journal, Health Literacy Research and Practice, in 2017. This is an online, open access, peer-reviewed, indexed, international, can I think of any other adjectives for this journal, online journal. Michael Pashorlo is our editor-in-chief and the research editor, and Cynthia Bauer is our practice editor, Howard Cabral, our statistics editor. You can see the URL there. If you are an author and considering publishing a research or a practice article, or you're just looking to find information, we do encourage you to take advantage of this free resource. Next slide, please. One of the things that we started a few years back was the Health Literacy Solutions Center. This is a hub, a central hub for members of the health literacy community. More than 10,000 people have signed on to this. When we say sign on, all we do is ask for an email and a password. We never sell email names or anything like that. But just signing on allows you to be part of this community and take advantage of all the resources. One of the main ones that we're very proud of is the Health Literacy Discussion List, which I know a lot of you participate in. This is a great opportunity for if you have a question about something and you just want to know, hey, does anybody know about a resource that can do this, that, or the other? You'll have a ton of people chiming in saying, oh, try this, here's that. Just a lot of really good, vibrant discussion that goes on there. There's also a learning lab where you have opportunities to, this is where you would go see the archive of this conference and past conferences. We have webinars. We have a resource library that you can take advantage of, blogs, just a ton of stuff. I really recommend you take a few minutes and just go browse through there. It's healthliteracysolutions.org. And I think you'll really find that to be a great resource. Next slide, please. Health Literacy Month. This is something that happens every October. Our good buddy Helen Osborne started this 20-something years ago. We're just kind of tagging along on her coattails. She really is the person who started this and got it going. And this is an opportunity for all of us to spread the word about health literacy to the rest of the world. This is sort of the month that we end up doing that. And as it says, building awareness through action. Healthliteracymonth.org is the URL. And actually right now is probably a good time to start planning some of your activities. And there's some guidebooks and resources at that URL that you can take a look at and take advantage of. Next slide, please. And I'm already over my time, but I'm just gonna soldier on here. We also have another microsite called Community Benefit Connect. Hospitals in the United States that are nonprofit hospitals don't pay taxes, but they do have to show a benefit to the people who are in their service area. And so one of the things that we like to do is provide them with some ideas and opportunities how they can work to advance health equity within their community. Within your community, if you are in the United States, I do recommend you search out, if you're looking to do some kind of community-based activity, your local nonprofit community or local nonprofit hospital, because they have to spend a certain amount of money on some of these activities, and they may be able to help you out with yours. So this is a site that we do to kind of advance that. Next, speaking of advancing, next slide, please. Some of our health literacy initiatives. The one that I'm probably the most proud of is one we just launched a little earlier this year, which is the Health Literacy Specialist Certificate Program. This is an education program very rigorously designed. It was based on a job task analysis that involved all of the various members, the very diverse members of the health literacy community. And it was based on answering two questions. What does a person need to be able to do? And what does a person need to be able to, what does a person need to know? And what does a person need to be able to do in order for us to consider that person to be a health literacy specialist? So this training program will take you through all of those areas and information that you would need to know in order to become a health literacy specialist. It was built according to the ICE standards, and there's continuing credits available. Next slide, please. So there are 7 domains, or what we call micro credentials, that are available. You can see the titles there. You can take any single one of these, match them up according to what your needs are, or if you take them all, then you will get the overall health literacy specialist certificate. There's digital badges available for you to show the world that you have taken these courses. But I really encourage you to take a look at that, and you can find more information about that on the Health Literacy Solutions Center. Next slide, please. We produce this annual conference. We've been doing this one for 21 years. Next slide. We also do the Health Literacy in Action Conference. This is a practice and policy conference that we do in collaboration with Cynthia Bauer and the Horowitz Center for Health Literacy at the University of Maryland. This will be our 5th annual. This is also a virtual conference, so that's coming up in October. Next slide, please. And then we have been partnering with HARC, and we've actually now are the sponsors for the annual Health Literacy Research Conference. Michael Paciorlo is the conference organizer for this one. This conference will also be held virtually this year, October 24th and 25th. And I think it's the HARC's 14th annual conference, if I'm not mistaken. So anybody who's interested in research, this is an excellent opportunity for you to get involved with the health literacy research community and just to really listen to what some of the cutting edge research in the world is. And this is an international conference as well. Next slide, please. And then we also partner with Arizona to put on a health literacy conference with them. I believe this is their either third or fourth annual. We were just trying to remember that just before we came online here. And next slide, please. And that's all I have to say. So I am going to sign off now and turn this over to the real star of the show, who is Diana Pena Gonzalez. She is our Health Literacy Education Director. She's been with IHA for some time now, and she is the brains and the inspiration behind all of the content for this year's conference. So if you have any complaints, throw those toward me. If you have any compliments, those all belong to Diana. So without any further ado, let me turn the program over to Diana.
Hello, everyone, and welcome to the 21st Annual Health Literacy Conference. We're happy to have you all with us. This year, each day of the conference focuses on a different topic. For today, day one, we'll look at communication as an emergent issue for the health literacy community. We are familiar with health literacy being the ability for people to find, understand, and use health information. But for the past couple of years, we've been challenged with the issue of accuracy, fidelity to the truth. So today is dedicated to communication and ways we continue to make information, as Rima Redwood put it, available, accessible, and most importantly, accurate. Tomorrow is dedicated to nurturing our health literacy community. It's dedicated to us, the workers, those of us that are trying to do some good work out there. We've read about maybe personally experienced burnout. We've heard about people changing workforces, and we've definitely heard about political pressures. But now, more so than ever, we need to sustain our work and ensure that nobody falls to the wayside. Excuse me. We have dedicated this day to pulling each other up, and these skills that we learned on Wednesday, we can also be transferred to our communities. The last day, on day 3, Thursday, it's dedicated to the changes ahead. Change is coming in many ways, it's already here. A whole day is dedicated to these changes and innovation as we continue to nurture and grow our health literacy community. Another way to nurture our community is recognizing it's going to take many organizations to accomplish our mission of health literacy and health equity. So we've selected a couple of organizations that are doing some great work out there. We aren't charging tuition this year to help support other organizations whose missions align with our conference aim. So if you enjoy this conference, please send them a couple of bucks to help their efforts. To do that, you just navigate to the homepage and click that Start Here button. Then just scroll down to the Pick Your Charity initiative. Nurturing community also means sharing ideas with one another. We've put together a virtual idea board for you to jot down any new ideas or insights you have gained from this conference. And who knows, your takeaways might help somebody else. We'll be highlighting some of these in the closing sessions, so make sure to write down your name on that sticky note and we will recognize you on Thursday. Another way we nurture community is we talk and we engage one another. Check out the attendee profiles and send a chat to someone to connect about a shared vision. Nurturing community also means helping and commenting on each other's efforts. I invite you to take a scroll through e-posters and send them a question. You can also rate the posters by using the heart rating system. Most importantly, nurturing community is celebrating wins. Take a look on Thursday to see who won the poster contest and make sure to send them a message to congratulate them. Before we jump onto the keynote session, Janet Ohene-Frimpong, a close friend to IHA, was originally scheduled to give a talk today, and due to a family emergency, she couldn't be here today. But she had a few words she wanted me to share with you. She writes, Hello, fellow Health Literacy community members. With my full heart, I really wanted to be here today. I've been looking forward to sharing some thoughts and perspectives with you and to continue to learn from you all. Nevertheless, life can be very tough at times, and an urgent family health matter has made it necessary to focus on caring for them. I hold you in high regard and feel deep gratitude for all the work everyone is doing, particularly in these difficult times. Have a productive and enjoyable conference. I look forward to the chance to join with you again. Until next time, Janet. Okay, so now we'll just run through some quick housekeeping items and we'll jump into our keynote session. So for questions about the conference or any IT, you can visit the virtual help desk, which is found on the homepage. For continuing education, there's kind of two places you can look. You can look on the CE information tab that's on the homepage on the left-hand side. Then that's broken down to CEs by each category. And you can also fill out the evaluations on that evaluations tab. So there's session evaluations and there's also overall evaluations. The recordings will be available. So all the live sessions today will be recorded and made available within 24 hours. So if you missed something today, you check back tomorrow and the recording should be there for you. For session information, so all attendees will be muted during the presentation and we'll address all the questions that you'll type into the chat right there on the tab on the right at the end of the presentation. So for your questions, please send those on the questions tab. And you have the ability to vote up questions. So if you see a question that you like or you think is a great question and you want us to answer it, make sure you vote on it. And the higher it is up on the queue, the more likely it is that we'll answer that question. You do get 100 points. And so they kind of depletes the more times you vote, but the longer you're on and watching sessions, you start gaining back your points so you can keep voting. In the discussion tab, feel free to write your thoughts and comments on there.